Hello, this is Randy Rolfe from the Institute for Creative Solutions, sharing foundational concepts about vibrant health through natural living. And today I want to reiterate an idea I've shared, I think, several times before, but it's really critical. And that is that in modern times, we've basically exchanged acute disease for chronic disease. In centuries past, people died from famine and infection and war and serious accidents, particularly in the Industrial Revolution. But today, many of those things we can take care of. We're lucky enough not to have war on our shores here in the US. And we've come up with the antibiotics to help against epidemics and infections, and famine is rare, although we have many people who don't get enough good food every day. But for most of the middle class, we have exchanged that for chronic disease, which most experts agree are completely preventable by good lifestyle choices, good eating habits, and minimizing our toxic load. So when we say that we're healthy, our readings may be fine, but if we're taking a whole lot of medications to get there, those are alien chemicals to the body, and they are a stress, and they can cause lots of side effects that can diminish our quality of life. So it's the lifestyle choices that I keep talking about that make all the difference, whether you develop diabetes or heart disease or stroke or arthritis or inflammation or GI problems, which are on a huge increase, as well as some of these other things, and cancer, which we know 20 to 40 years of exposure to certain chemicals, whether it's the particular chemical or an accumulation of foreign chemicals, can really mess with our DNA and cause aberrations in our cells that can develop into cancer. So all of these chronic conditions are developed from long-term lifestyle choices, being exposed to unnatural chemicals, to poor lifestyle choices, poor eating choices. So it's worth learning something about what works with the body and what doesn't, to try to minimize the occurrence of chronic disease. We already are fairly careful about accidents, and we can prevent a lot of infections and the effects of epidemics and famine, but we have to take our own self-care into our personal hands to make the right lifestyle choices to minimize the appearance of chronic disease. So let's make those choices and finish out the year in good health and start on with the new year to have an even healthier, more vibrant health. That's it for today from Randy Rolfe at the Institute for Creative Solutions. Thank you.